General West, I'll direct this question to you. It's kind of a follow-on from what Senator Daines has raised about those who are afflicted with these horrible diseases to which there is seemingly no hope. One issue that I choose to raise here before this Appropriations Subcommittee every year is the peer-reviewed medical research accounts. This is a program that I have supported over the years, and one component of that program that I have great interest in is the ALS research program. I think we know that, unfortunately, our military members have a higher incidence of ALS, a 60% higher rate than the civilian population for reasons that we don't know. But what we do know is that currently there is no cure, there is no treatment for ALS, and it is a horrible, horrible disease for an individual to live with. We have seen over the past few years a funding level for that component of about $7.5 million a year. We're kind of stuck at that level. Again, when you recognize the connection to our military, to our veterans with this disease, it just seems to me that this ought to be an area where perhaps we should be looking at better resourcing. I would like your comments this morning in terms of, first, the effectiveness of the important research program that we have going, both in terms of identifying causes and cures, but also in terms of identifying some therapies that might help ALS patients live more productive lives, and whether you feel, whether you're satisfied with the funding levels that we have seen over the years for this component.
Senator Murkowski, thank you so much, and I really appreciate the support that you've had on this topic and this condition over the years. And I do appreciate, since 2007, about $62 million to help us identify research projects. And during that time, there's been 54 projects that involve the country's leading experts on ALS to determine where we can, get more information on cures and the etiology, why, and then why 60% of our veterans. What is it about our veteran population that they are higher? And actually, Gulf War vets are 2 times more likely to have ALS for reasons unknown. So the good news is that there is some progress that we can report. There's been funded the development of small molecules, stem cell therapies, biologics, and then there's some gene therapies that are showing promise. Right now, there are 4 of these that have progressed to industry-backed advanced drug development, or at least advancement in determining that, and 1 has actually moved into early phase clinical trials. So I'm happy to report that that investment has led to some very promising, potential therapies in the future. So I appreciate the support of that, and we'll continue to work diligently to determine with those experts to come up with more results for that. But I do appreciate the funding levels that have been put towards this very devastating disease. Thank you.
We'll know that this will continue to be a priority of mine, as well as those of other members here. But I appreciate the continuing efforts. Again, we don't understand the connection, but what we do know for certainty is that this is a deadly, horrifying disease, and we've got to be doing more. And what we are able to do working with DoD has been significant over the years. You note the progress, but for those who are living with ALS, it's pretty dire right now.